Your Majesty, Your Excellencies, ladies and gentlemen, thank you for participating in this technical briefing, Mental Health Time to Scale Up, at this 72nd session of the World Health Assembly. I'm James Chow, the World Health Organization Goodwill Ambassador for SDGs and Health, and a particular welcome to the WHO Director General, Dr Tedros Adhanom Ghebreyesus, and a special welcome to Her Majesty, the Queen of the Belgians, who continues to serve good health and well-being for people everywhere, and in particular to the many of us with mental health conditions. In such, you are honoring not only mental health, but you're honoring the gift of life and also humanity. Thank you very much for being here with us. The fact that this room is very full is full testament also to the importance of this issue and the collective desire to make sure that everyone, everywhere, has genuine access to mental health care when and where they need it. Mental health conditions account 1 in 5 years lived with disability globally, and it creates more than $1 trillion per year in economic loss. And we look at more of what's happening. One person, one individual, one member of a family dies every 40 seconds from suicide. And indeed, suicide is the second leading cause of death amongst our young people, 15 to 29-year-olds. Rates of mental disorders more than double in emergency-affected populations, yet more than 3/4 of people with mental health conditions in low and middle-income countries receive absolutely no support at all. So, mental health is obviously a human rights issue because of the right to health and because too many people, too many of us with mental health conditions are having their rights violated every day when seeking care in all countries of the world. During the last year or so, we have seen renewed energy, renewed commitment towards making mental health a much larger, more expanded priority, and not just as a health issue, not even just as a development issue, but as a life issue at the very center of the political global mandate. This session is being brought to you live stream and also in all official 6 UN languages through simultaneous interpretation. Now, a year ago, things began to revolutionize yet again. In fact, even before that, in 2016 in World Health Day, WHO chose depression as its theme. And then 12 months ago, Dr. Tedros identified mental health as a topic that would be given particular focus for accelerated implementation in the 13th General Program of Work. Dr. Tedros, if we look back to that year ago, you identified mental health as an area of health that you would personally advocate for. We look forward to your words to guide us moving forward, either here or there. It's up to you. Thank you.
Here or?
As you wish. As you wish.
You're the boss.
Oh, I'm not.
You're driving the... Okay. I got the signal. Yeah, thank you. Thank you very much, James. Your Majesty Queen Mathilde, we're really fortunate to have you here, and we're very grateful, and we're very happy. It shows your commitment, your presence here today. And we had a discussion before we came here. Her Majesty stressed 2 things. One is a family, individual, family, and community-based approach is important, crucial. And second, from the health system, focus on primary health care is important. These are important messages, and I fully agree, Your Majesty. And thank you so much for your leadership and commitment on this issue. Excellencies, ladies and gentlemen, it's such an honor to be here today, and I know you will agree with me when I say there is no health without mental health. The WHO Constitution includes mental health in its definition of health, and yet services for mental health care are still lagging a long way behind services for physical health in most countries. Mental health conditions are on the rise in every country in the world. Today, nearly 1 billion people are affected by a mental health condition. Depression is one of the leading causes of disability worldwide. Suicide is the second leading cause of death among 15 to 29-year-olds. people with the most severe mental health conditions die prematurely, as much as 2 decades early, due to preventable physical conditions. Awareness of the importance of good mental health is growing, but we're a long way from providing the prevention and support services to meet the needs. Over 3/4 of people with mental health conditions in low and middle income countries receive no support at all. On average, countries spend 1% to 2% of their health budget on mental health, and mental health receives less than 1% of international aid for health. You can imagine to what extent it's neglected. We need to take urgent action to scale up services, learning from those countries which have been successful in this area. The number of people with mental health conditions requires that the entire health system is involved. We need primary care workers who are familiar with these conditions and able to identify and manage them. We need specialized care and services whenever available, working closely with primary care personnel. We also need community peers learning and developing skills to provide support as needed. Schools and universities, employers and social workers all have a role to play in promoting good mental health and providing support for people who are struggling. And we need political leaders who fully understand the health, social, and economic benefits of providing quality mental health services and are committed to scaling up services. That's why I'm pleased that many countries are working to integrate mental health in their health systems. Many others are also advocating at a global level for this situation to change. The mobilization of all those I have identified and more is essential because it's a silent killer, and we cannot understand and fight it unless we all do it together. And today, we say it's time to scale up, to fight this silent killer more aggressively. WHO is committed to continuing working with all of you to achieve universal health coverage for mental health. And once more, I would like to end my speech by thanking Her Majesty, Queen Mathilde, for her commitment and leadership. And also thank you to all panelists here. Really appreciate it. Thank you.
Thank you very much to Dr. Tedros. I'm now honored to introduce Her Majesty, the Queen of the Belgians. Just last week, the Secretary General appointed Her Majesty as a new Sustainable Development Goals advocate. Her Majesty has long been a champion for mental health, for people with mental health conditions in her own country and also globally. We look forward to your words.
Monsieur le Directeur général, Excellences, Mesdames et Messieurs, en acceptant la fonction de défenseur des objectifs du développement durable des Nations Unies, j'ai décidé de faire de la santé mentale l'une de mes priorités. Je suis donc heureuse de pouvoir contribuer à la réflexion sur ce sujet crucial. Comme vous le savez, la promotion de la santé et du bien-être pour tous fait partie des SDGs. Dans le cadre de l'objectif 3 sur la santé, la communauté internationale s'est aussi fixée comme perspective de promouvoir la santé et le bien-être mentaux. Sans une bonne santé mentale, ni les personnes, ni les sociétés ne sont en mesure d'atteindre leur plein potentiel. Investir dans le capital humain est une condition essentielle pour le développement. Les problèmes liés à la santé mentale concernent les personnes de tout âge et de toute origine sociale, qui peuvent être affectés par des maladies d'origine génétique ou physique, mais aussi par le stress et par l'anxiété. Nous savons que les jeunes et les personnes âgées sont plus fragiles. Tous les pays, qu'ils soient développés ou en développement, sont concernés. De plus, les événements vécus dans des situations de crise, comme les conflits et les catastrophes naturelles, mais aussi le dénuement extrême et la violence au quotidien, qu'elles soient physiques ou mentales, sont à l'origine de traumatismes psychologiques profonds. Pour se reconstruire et retrouver leur place, les personnes affectées, comme les enfants soldats ou les victimes de violences sexuelles, doivent être mieux accompagnées. La stigmatisation des personnes souffrant de problèmes mentaux et le tabou qui les entoure constituent partout dans le monde des freins considérables à leur prise en charge. Il faut poursuivre les efforts pour rompre ce silence, si nous voulons mettre en œuvre l'un des principes fondamentaux de l'agenda 2030. Personne ne doit être laissé pour compte. Mais même ceux qui cherchent conseil et assistance peuvent se heurter à de nouvelles difficultés. Trop souvent, l'offre médicale et sociale de qualité manque. La santé mentale n'est pas considérée partout comme une priorité. Les moyens mis à la disposition du secteur de la santé mentale demeurent trop modestes. Dans cette perspective, la prise en compte des pathologies mentales dans le cadre de systèmes de couverture de santé universelle devrait être généralisée. De plus, le nombre de professionnels qualifiés demeure insuffisant. Il est donc essentiel de susciter des vocations pour ce type de formation. Aujourd'hui, pourtant, des formes nouvelles de prise en charge se développent pour offrir des alternatives à la médicalisation et à l'institutionnalisation. Elles font davantage intervenir les patients eux-mêmes, les familles et les communautés, mais aussi des volontaires et bien entendu des professionnels dans une approche plus respectueuse des droits et de la dignité humaine. J'ai eu par exemple l'occasion de constater les effets positifs de projets centrés sur la musique, auxquels prennent part des enfants et des jeunes en difficulté psychosociale. Lors de ma récente visite au Mozambique, j'ai pu visiter des services de santé dans la province de Gaza, en particulier un projet de l'OMS à l'hôpital de district de Chokwe. Au-delà du dévouement du personnel soignant, travaillant dans des conditions difficiles, j'ai été touchée par la solidarité entre familles et amis dans l'accompagnement des enfants et des adultes en difficulté. Même si les origines des problèmes de santé mentale sont multiples, même si les relations de cause à effet ne sont pas univoques, il faut investir davantage dans la prévention. Il faut traiter aussi les causes sociales et environnementales du mal-être psychosocial, qui résultent parfois de la pauvreté et de l'anxiété qu'elle génère, de relations familiales dysfonctionnelles, de liens sociaux défaillants, de conditions de travail difficiles. Si nous voulons accélérer la mise en œuvre de nos objectifs en matière de santé mentale, les résultats de la recherche et d'expériences concluantes doivent être partagés le plus largement possible. Les mettre à disposition dans les langues accessibles à diverses communautés de chercheurs, de soignants, d'accompagnateurs sociaux et bien entendu des personnes directement concernées, permettrait d'élargir considérablement le dialogue mondial sur la santé mentale. Comme pour tous les SDGs, il est urgent de donner une nouvelle impulsion à la mise en œuvre de l'objectif 3 des Nations Unies en matière de santé mentale. Votre débat d'aujourd'hui, ainsi que la nouvelle initiative de l'OMS sur la santé mentale, constituent à cet égard des signaux importants. Nul ne peut ignorer que les défis restent immenses, tant pour faire prendre conscience des enjeux de la santé mentale et répondre aux besoins que pour faire changer durablement les habitudes. Je vous remercie.
Thank you very much, Your Majesty. You've reminded us again that without good mental health, as you said, and you don't always hear those words together, good mental health, there can be that. No one can fulfill your full potential, you said, and I think also in your new role as an SDG advocate, you will again be at the global center of transforming communities and the lives of people in those communities everywhere. Thank you very much. Let's go then to everybody, all of us here in the room, who are helping to break and shatter that silence together. And we move now to our first panel, beginning with Zulema Thomas, who is the Minister of Health of Peru. Dr. Thomas is the new Minister of Health of Peru. She is leading a sweeping change of current large mental health reforms throughout her country, thereby reshaping the opportunities in the Latin American region. She was previously the Director of the National Institute of Child Health. Dr. Thomas, Peru has made huge progress in stepping up the coverage of mental health care, and with the establishment of more than 100 community mental health centers in the last 4 years, we're now learning that coverage has gone up by over 150% in areas with this new service available. Such progress is obviously central to implementing the WHO's own mental health care plan. But what I want to ask you, Minister, is what are the strategies in your vision going forward? What's going to happen as you enhance access and as you expand that coverage to hopefully people everywhere?
Quiero agradecer, señor director de la Organización Mundial de la Salud, Su Majestad Reina de Bélgica, y creo que una imagen habla mejor que las palabras. Quiero previamente mostrar un video de lo que venimos haciendo en nuestro país en cuanto a salud mental.
Para mí la vida casi ya no tenía sentido. Vivía como zombie, caminaba, me pasaban la voz. Tuve una vida muy terrible.
Orlando, un serigrafista de profesión, pasó por un periodo sombrío en su vida.
Primero falleció un hermano muy cercano que vive acá en Lima y después tuve una separación de mi esposa. No podía yo soportar tanto dolor.
Él no lo sabía, pero estaba pasando por una fuerte depresión.
Yo me sentía muy mal porque yo no dormía. Máximo dormía 1 hora, 2 horas y me dolía mucho la cabeza.
Bienvenidos al Centro de Salud Mental Comunitario La Victoria. Atendemos 4 unidades de atención y entre ellos está correspondido lo que es ansiedad, depresión, consumo de sustancias, adicciones, patologías.
Como soy vecino, yo pasaba, pero no me daba cuenta que era un centro de salud para personas que están pasando problemas emocionales. Lo que más me interesó fue la atención, como si fuera una atención familiar.
Tenemos servicio de adultos, servicio de niños y adolescentes, servicio de adicciones y tenemos el servicio de participación comunitaria que se encarga de hacer el enlace con los tejidos en red de nuestra comunidad.
A nivel nacional existen al menos 103 centros de salud mental comunitarios que cuentan con equipos multidisciplinarios para ayudar a personas con problemas de salud mental y emocional. Esto es parte del plan de continuidad de cuidados, es decir, los acompañamos desde sus domicilios para trabajar junto a sus familiares para su inserción en la comunidad.
Inicié ahí mi tratamiento. Me derivaron a psicología, después a psiquiatría. Me sentí muy bien con el tratamiento y todo.
Gobierno del Perú. El Perú primero.
Nada grafica mejor el respeto al derecho humano a la salud y la humanización de los servicios de la salud que el cuidado de la salud mental. Son ampliamente conocidas y difundidas las altas prevalencias, la alta carga de morbilidad, las grandes brechas de atención y los inmensos costos de las enfermedades y problemas de salud mental. Nuestras sociedades padecen en gran porcentaje, y lo hemos escuchado, de salud mental. En el Perú, la depresión ya es la enfermedad que tiene mayor carga de enfermedad, de morbilidad en general, en cuanto a la población, superando a enfermedades cardiovasculares, a enfermedades infecciosas y a enfermedades oncológicas. La conciencia y los esfuerzos por atender adecuadamente la salud mental en el Perú viene de varias décadas atrás, hasta que en 2013 una comisión se encargó de poder integrar el tratamiento de salud mental a través de centros de salud mental comunitario. Hicieron posible un cambio innovador. Incorporaron la atención de salud mental a través de un seguro integral de salud que financia el tratamiento, pero a su vez también a través de un programa presupuestal. Empezamos el 2015, que fue la proporción donde se administró aproximadamente 30 millones de dólares, y este año 2019 hemos empezado con 100 millones de dólares para poder seguir tratando estos centros de salud mental comunitario, porque es una política de Estado de nuestro gobierno. Los centros de salud mental comunitario son espacios de atención especializadas, como ustedes han visto. Está conformado entre 15 y 20 equipos profesionales de la salud, entre psiquiatras, psicólogos, enfermeras, médicos de familia. A su vez, cada uno de estos equipos atienden aproximadamente de 2.000 a 3.000 personas dentro de la población donde se ubica este centro de salud mental comunitario. Están en todas las 25 regiones de nuestro país. Este año estamos incrementando de 103 a 159 centros de salud mental comunitario. Y por ende, quiero agradecer también a un informe del Banco Mundial donde confirma la sólida aceptación de sus equipos humanos en cuanto a la prestación de servicio de la salud mental. La capacidad de estos equipos han conseguido de que este tratamiento sea, como ustedes lo han visto, en forma integral y familiar. Los centros de salud están conformados para atender estas enfermedades: depresión, violencia familiar, violencia de niños y adolescentes, y que muchas veces estas violencias se traducen finalmente en violencia sexual a nuestros niños. Tenemos graves problemas de salud mental y es por eso que como política de Estado se ha restablecido estos centros de salud para brindar nuevamente el tratamiento y la confianza a las personas, a la familia y a la comunidad. Se ha constituido un privilegio y una creación de poder seguir incrementando hasta llegar a 259 centros de salud mental comunitarios. La reforma en salud mental ha ganado amplio respaldo en los sectores políticos, internacionales, académicos y medios de comunicación. Y estamos en condiciones para escalar a todo sector de salud en todo el territorio nacional e incrementando progresivamente su financiamiento. Finalmente, Su Majestad, permítanos agradecer a través suyo a su país por el apoyo de cooperación belga que tuvo lugar en todos estos años para el tratamiento de nuestros niños y adolescentes de nuestro país. Señores y señoras, nadie se puede quedar atrás. La salud mental no espera. Muchísimas gracias.
Thank you very much to Dr. Thomas, the Minister of Health of Peru. We also acknowledge joining us Dr. Susanna Jakob, who's the Deputy Director General of the WHO. Moving on, it was very important for us today to present you not just with a governmental picture of mental health, but first and foremost to give you the voice of the people. We're going to move now to NGOs and civil society, to Peter Badima Giaro, who is the Executive Director of Basic Needs Ghana. It's an independent group that seeks to improve the lives of those with mental health disorders in his country. Mr. Yaro has given 20 years of his professional life towards this, supporting income generating for mental health service users, advocating for the inclusion of mental health within the core public policy and also program. And he's also worked across the community, knowing that one size really doesn't fit all. In his community, that means working with traditional healers, working towards self-advocacy, and also working towards mental health for people who are in prisons. Mr. Yara, I want to ask you about the overall picture in Ghana, not only with Ministry of Health, but with Ministry of Health in partnership with civil society. When you look at basic needs, other programs, other groups like United, like Quality Rights, what's the picture over there?
Thank you very much, James. Your Royal Highness, Excellencies, honorable members, thank you to the WHO for giving us this platform and to United for Global Mental Health for sponsoring me to come and be part of this distinguished panel, and thanks to the government of Ghana. I'd like to start my briefing with a short film on one of our beneficiaries who I think tells completely the story.
Basic Needs trained Sotsar Tawele, a community nurse, to diagnose and support people like schoolteacher Francis Kubila. Several years before they met, Kubila had begun to exhibit erratic and violent behavior. This led the village's traditional healer to lock him up.
His family particularly thought that he was a danger to himself and to the community, especially his wife and children.
This is a gentleman who probably has quite an important psychosis or schizophrenia. He'd been locked down in his own home. Now, when I say locked down, I mean his leg had been pinioned in a large log. A hole had been bored through the trunk. The leg had been inserted into the hole.
Then they use some nails to lock it so that the leg cannot come out. So I had to be sitting there naked like that. Defecation, eating, urine, and everything was where I was.
The Lord was said to have some spiritual powers to help in his healing. And that was the reason why the traditional healer had put his leg in the log.
Kubila's family left him attached to the log for 2 years.
And this is very typical of what happens to people where mental illness is ill understood.
Kubila was finally released because the community nurse's training helped him recognize what the village healer had not, that Kubila had a treatable psychosis. The nurse gave Kubila medicine that improved his condition quickly. Basic Needs then helped him find a new teaching position.
Our goal is to get people back into work.
To do that, Basic Needs has developed unique apprenticeship programs that have equipped thousands of people with the skills they need to make a living.
For example, we negotiate land from traditional chieftains, and the land is then used for training people or retraining them in agriculture. And that apprenticeship structure, which is quite common in Africa, is one of the ways in which we can really get people back into employment. It's crucial to not only your survival, but also to the reduction of stigma, which means that you get accepted back into society.
A pair of shoes, from a pair of shoes, yes? You can imagine all these ordeals you go through. I don't want to mostly remember them, but it cannot be cut off from my mind. But I got relieved when I was released. But as a family man, if I am not working, how will I be able to feed this large?
We have reached out to people in their families, in their homes, in their workplaces to say mental illness is not what you think. It is one anyone can experience, and that there are ways by which you can manage your mental illness and live a productive life.
Very much. So Francis is one of some 40,000 people that Basic Needs Ghana and its several collaborators have reached out to and enabled them to gain treatment and to live and work in their communities. Basic Needs Ghana, we implement an innovative approach that is promoting community-based health treatment within existing health facilities and strengthening productive and income-earning capacities and opportunities for persons living with mental disorders. Self-help groups of people with lived experiences and their primary caregivers are established to provide each other peer support, and through these self-help groups are challenging the social stigma associated with mental illness in the communities that we have all spoken to. We are very proud with the WHO Quality Rights for Mental Health, which is currently implemented in Ghana, where over 2,000 people have already been trained. And these are health workers, service users, advocates, social workers, through e-training and face-to-face training. And we've also made very much use of the MH gap of the WHO implementation guide. And these have further improved and promoted patient-centered recovery and service care modeling. We are very happy to a number of agencies that have supported us. And I would like to mention the UK Department for International Development that for the past 5 years has supported Basic Needs Ghana and the government of Ghana to implement mental health, especially our model of community-based mental health and development. And Comic Relief, the European Union, Grand Challenges Canada, the National Institute of Mental Health of the National Institutes of Health, and Fondation Dakot. And of course, our government is also doing its bit. But these are just small steps, and much more giant strides are needed to reach the over 1 billion the Secretary General has, the Director General has just talked about, who need mental health care services, especially women, youth, and the elderly. Your Royal Highness has already spoken to these, and I entirely agree. In Ghana, Francis is just one of 3 million people who are needing treatment for their mental disorders. There is a 97% financing gap for community mental health. Whatever comes goes to our 3 psychiatric hospitals, and it's just to feed inmates. And that is not helping. They are not combined more than 2,000 people when we have over 3 million. So that is affecting the level of community care that can be provided, which we all know works. And this can be seen in the shortages in medicines. Community health workers cannot do home visits to support families and individuals who are under treatment. Less than 50% of the entire population of Ghana really understand mental health issues. And because of that, it doesn't go beyond them thinking that it is through witchcraft and demonic attacks. And that is why we have also reached out to traditional healers and traditional authorities to begin to break down this fixated perception that has been with us for years and has come through our socialization. Our social protection schemes, such as the National Health Insurance Scheme and the cash payments that we all call LEAP in Ghana, have not yet reached people with mental illness, and they need it more. If we see the example of Francis going back to work, the number of people who go back to gardening, farming, craft making, and the rest. So, Your Royal Highness and Excellencies, there is much to be done. And it is in this regard that the Speak Your Mind campaign is calling on you all to prioritize mental health in the efforts to realize universal health coverage and the achievement of the Sustainable Development Goals. There is enough evidence on what works in mental health. Achieving universal health coverage for mental health should be anchored at the community level. That has already been expressed. And we, as Basic Needs and our collaborators, have taken this head on and encouraging government to take that up. Because making social workers involved employers, schools, and universities is the right way to go. But it requires money and political will. And this is where the campaign wants to emphasize that we need to really put our efforts on mental health. Let's commit that political will, which makes us want to get voted year in, year out to support mental health. So we call on the investment, on everyone, particularly governments, to invest in mental health so as to educate everyone and to empower persons with mental disorders for a fairer world and a truly sustainable, people-centered development. Let's ensure we reach the WHO target of 100 million people with mental care needs access quality and affordable mental health care within the next 5 years. I thank you for the opportunity.
Thank you very much, Peter. So we've brought you Latin America, we've given you Africa. We're going to move now to the Asian continent, to Saima Wazid Hussein, who is the chair of the National Advisory Committee on Autism and Neurodevelopmental Disorders. She is a school psychologist. She is an expert on neurodevelopment disorders and mental health, a speaker and also an author. 2 years ago, she was the WHO champion for autism, and she's brought national, regional, and global focus to autism spectrum disorder, advocating for a more inclusive approach on appropriate health methods to address this. Her efforts have led the WHO and the UN directly to adopting an international declaration on autism. Dr. Saima, you're from Bangladesh. You're playing a lead role, an advocacy role in autism, and increasingly in mental health in general in Bangladesh throughout the Southeast Asia region, as we said. But what can you tell us about what we here can learn? Because we're not here just to tell the good story. We're here to share what can work in significant population sizes such as your own as well. And we're not just talking about services or integration. We're going beyond that, deeper. We're talking about dignity.
Thank you so much, James. It's such a pleasure to be here, and I want to really congratulate the Secretariat for organizing a technical meeting. Oftentimes we have resolutions, and then we don't really end up focusing as much on the work, and this session really kind of brings it to the forefront. I'd really like to thank the leadership of Your Majesty, and the things that you have said in there has really resonated with me, because as much as you know, I've prepared a country picture, because that's what I was supposed to really provide, very technical information. I had to sift through the data so it's the most relevant and interesting. But before I do that, I'd like to give a little bit of a personal picture. When we talk about mental health and surviving trauma, I am a survivor myself. In 1975, when I was only 2 years old, my mother, Sheikh Hasina, lost 18 members of her family, all of her closest family members, in a very tragic military coup. So overnight, we were completely socially, morally, financially, completely devastated family. So I grew up in that family. But along with that, for us personally, came the fact that my very brilliant father, who was a scientist, was more traumatized, let's say. He ended up with what I believe was either bipolar disorder or schizophrenia, untreated his entire life. So I grew up in a family where I saw verbal violence, physical violence, maladaptive behaviors of all kinds. I survived, with a few issues, of course, but I survived. Later on, as an adult, I saw depression very close up front. While studying, I was married. I was studying clinical psychology. And my mother-in-law, within 4 years of my marriage, within, say, third year, I noticed her very unusual behaviors. Within our 4th year, she committed suicide. That was her third and final attempt. And having seen that up front really changes you. Let's say, it definitely changed my career plans. I was not up to doing psychotherapy and dealing with suicide. I became a school psychologist and worked with children instead. You know, everything has a purpose. But what that really indicates is when you have somebody in a country like ours, where there is so much extreme stigma and prejudice, and you do know somebody has clinical depression, you cannot access the help. It isn't just that the help is not really there, it's that you are unable to access it because of the stigma it indicates. So mental health has always been something extremely neglected within the health community, within our development plans, and it really shouldn't be. So let's give you a little bit of the data that I talked about, because I can go on talking about it, certainly. This, for me, in many ways, has been difficult to talk about publicly, but is also cathartic in its own way. In Bangladesh, we have a population of 160 million. So we have 250 psychiatrists. Would I say that they are the most proficient in providing mental health support? Not necessarily. Very good in prescribing medication. But clinical psychologists, we have 60. We have general physicians who've had mental health training under the WHA, about 10,000. We have nurses trained in mental health, about 12,000. These are a drop in the bucket. We have less than 1% of our health budget allocated for mental health services. In a recent prevalence study, 2016, not very recent, we had 32.8% of the population were found to be living with a mental health condition. In 2018 studies showed that 42% of adults who were living with a chronic, non-communicable disease like diabetes or heart condition were also experiencing severe mental health issues. So given these numbers, one of the good news is that in Bangladesh, under the guidance of our current health leadership and the Director General has really taken on this issue. We have now a brand new Mental Health Act. Up until very recently, our act was the Lunacy Act from the British era, so very old-fashioned. But our new mental health policy that we've just finalized is much more resonant of current practices. I was very closely involved in that. It is much more comprehensive. It goes beyond what is traditionally just in the health system. It really talks about how the community can be supported. We're developing right now a national mental health strategic plan. Of course, I've been very fortunate to be selected as one of the leaders of that. The goal within that strategic plan is similar to what we did with our national strategic plan for autism spectrum disorders in Bangladesh. The idea is to identify priority areas and create a roadmap of activities that includes both awareness and advocacy, as well as policies and human resource development. Like I mentioned before, we don't have the right number of human resources that we need. We do not have the professionals to really even begin to think about providing comprehensive services, leave alone take it into the community. We plan to have an integrated mental health care that is involved and part and parcel of the existing health system. It's holistic and multi-sectoral, as well as involves approach that is both from childhood to adulthood, including providing prenatal care. The focus will be on ensuring that we build resilient individuals and resilient families, and we look not just mental health as a disease, but a way to have psychosocial well-being as a primary target of our entire health and social support system. And the only way we can achieve this is that if we have collaborative, effective partners, both within the country as well as development partners. So, Bangladesh is certainly committed to move forward. We hope to be a leader in innovative support mechanisms, because to be very honest, and as a mental health professional myself, mental health diseases, disorders, whatever you'd be comfortable calling, has seen minimal innovation. we are very much stuck in a very old era. We have not focused on what we now know to be facts about how the brain works, how emotions are developed, how human beings really function holistically. So certainly with our genetic proponents as well as whatever traumas and things that we experience. So we do need some innovation in this field, and I'd like to just end by thanking WHO for really promoting and bringing this into focus, and I hope to see some true change now happen. Thank you.
Dr. Simon, I know I asked you to put away your speech when we first came here because I knew that we are moved not just by what we've prepared, but what we feel inside of us all. And it's a tremendous honor always to hear someone's story and to choose to make yourself very vulnerable in a very public space as well. So thank you very much to Dr. Simon Wazid Hussein. We thank all of our first set of panelists. We invite you to rejoin the audience in the front row, and we ask our second set of panelists to take their places. We'll have Piroska Östlin, we'll have Erika Placella, and we'll also be joined by Ed Whiting. Let's move now to our second panel, and then we're going to jump into the audience for spontaneous interventions from our member states, from all of our delegates as well. The way we set up is like this. We've invited these three panelists also to give their feedback to the new WHO special initiative, which is now going to be presented by Deborah Castel, who is the new Director of Mental Health and Substance Abuse here. Congratulations, Deborah. We are going to hear from you on an ambitious initiative to ensure mental health reform in 12 countries, and this will safeguard that 100 million more people have access to UHC for mental health. This would be 100 million people more towards the 1 billion UHC goal of the WHO's global program of work. So, Dr. Deborah Castel.
Thank you, James, very much. And thank you, all of those sitting here in this podium. It's really an honor and a privilege for me to be here. I'm going to go through this WHO special initiative for mental health that we just recently developed, and we can move to the next slide, please. And as it was just mentioned by James, you are all aware of this framework of work that we have been given by our Director General in the 13th Global Program of Work and the ambitious 3 billion goals that we have been set up and given us as a real framework where to move. And this is aligned, of course, with the Sustainable Development Goals, as we heard before, and we think, and we have heard enough so far during this session, that mental health should be really part of that. And this is what we are planning with this initiative. The next one, please. Why is mental health important? You have heard a lot about it. I'm not going to go through the details. We are talking about high prevalence. We are talking about a very serious burden of disease. We are talking about a huge number of people that suicide every year, and we know that the figure we usually use, that is 800,000, may be an underestimation. We are talking about 1 in 5 years, mental health conditions being the cause of 1 in 5 years lived with disability. And what is also perhaps more important, and something was already mentioned, is that the coverage for care for those people is extremely low in both developed and developing countries, of course, even lower in the developing world. We know that human rights violations, stigma, and discrimination are a regular presence in in most of the countries we work with. And then particularly relevant also all these issues in communities affected by a humanitarian crisis or any other form of adversity. The figures are significant also in that area. So we designed this WHO Special Initiative for Mental Health with a vision that is all people achieve the highest standard of mental health and well-being. We are ambitious, and we think that it's time for this ambition to be spelled out clearly. And the goal, as it was anticipated, we hope that we work for achieving in 2023 access to mental health care of quality and affordable care to 100 million people at least in these selected 12 countries. The next one. We are focusing, I hope you know, we all know that there is a global action plan on mental health that sets the framework for our work. So all what is going on, all what we are doing, all what we are committed to do is already written, is already on its way. We hope that then the plan is going to be extended for 10 more years because a lot still needs to be done, and we are lagging behind, as Dr. Tedros said earlier. So in this strategy, we are focusing on two main areas of work. On one hand, advocacy, policy, and legislation. On the other hand, we really want to go through coverage, service coverage. We really want to scale up interventions and services at every level of care, community-based, general health, even specialist services. We know that from the very limited budget that the health sector offers to mental health, we heard examples before, most of that budget goes to old-fashioned institutions. Thank you. This needs to change, and we need to reshape a bit this landscape of care and services globally. So we are talking about services at different levels, as I mentioned, and where is this implementation going to be taking place? We are talking about 12 priority countries. We have not defined which are those countries. We are discussing which are the countries that among all of those that have decided in the planning exercise that we have gone through with WHO have said mental health is a priority. Some of them will commit further and will say, okay, let's go, let's do this together, let's work on this together. And then we will be sure that there is a balance among the regions we work with, and that we will identify the member states, of course, as a first partner, but then also local and international agencies that may be interested in implementing, together with the ministries of health, together with other agencies from the government, and together, of course, with WHO and NGOs and other UN agencies, these initiatives. We hope to have dedicated WHO staff at country level, helping the local authorities and local partners to push this, to move this agenda forward. And how are we going to do that? Well, we are talking about this alignment between the three levels of WHO, the country, the region, and headquarters here in Geneva, to support the countries on one hand to assess the current situation, of course, and to begin from there. What is the situation? What are the priorities? What are the needs in that specific country? And then design approaches that are valid for that specific context. And we will demonstrate, and that's the main scope, and that's why we are talking about a long-term investment or medium to long-term investment, because we want to demonstrate that there is a possibility of a sustained change, that whatever is happening is not going to end up when the money finishes, when the project implementation is over, when the donor is moving to another country. No, we are trying to look for a long-term commitment and a long-term sustained change. And of course, we are leveraging opportunities for additional resources. We want this to be catalytic, so other partners, other agencies, other local and international agents in general may join the efforts and use this as an opportunity to further develop. Next one, please. So what we will do through this special initiative, we will advance, of course, mental health policies, legislation, and human rights. Advocacy should be a main component of this. We will work in the mental health reform, as mentioned, across different levels. And by levels, we mean the levels of the health system. We heard before our Director General talking about the emphasis on primary care, but we are not going to stop there. We want to integrate, whenever available, resources that are usually allocated at the secondary care level that frequently are dissociated with what happens at the primary care level. And of course, the community. We need to work with the community. We need to work to promote mental health at the community level and to give the community the tools that they need in order to generate mental health and to also in order to collaborate with those levels of care in order to make sure that mental health reaches everybody. And when we talk about mental health conditions, we talk about neurological issues, we are talking about epilepsy, dementia, and we are also talking about substance use conditions. All of that should be part of the package that we are trying to promote, with all the interventions that we know are effective and are based in evidence that we know work, but not as isolated interventions, but part of an integral system. We will engage, of course, local champions, including particularly people with lived experience, in advocacy, in planning, and we need to learn how to listen seriously to this group of direct partners in this adventure. We will then scale up quality interventions and services, and we will promote the integration with other areas of health. We have, over the years, fragmented the person according to the different conditions and diseases, but the person is one, and we have to merge the opportunities whenever available to offer integrated care to that person, whether it is with HIV, with non-communicable diseases, of course, with any other area that is needed and required. The next one, please. What budget do we need? And I repeat, do we need? It's not a budget that we have, but we are looking for. We are talking about 60 million of catalytic funding. We are not dreaming to solve the problems of 12 countries with that, but we know that through that we can go beyond farther. And we are talking a cost per country per year of 1 million. We are talking about 5 years of intervention, so 5 million per country, 12 countries, 60 million. We want to make sure that in working with WHO, with the Ministries of Health, this will involve, as I said before, everybody else to join this common effort. The next one, please. Now, where are we coming up? What do we bring to this discussion? What is our experience as WHO? The next one. And I brought just some pictures that I was digging in my computer early this morning to be sure that we were talking about concrete things. So you can see the first team meeting of a newly built community mental health center in Kosovo after the war. You can see a remote locality in a very remote area in the north of Albania also, with a new mental health facility. You can see a team of outreach mental health professionals in Belize with their bicycles ready to get out. Those are examples of how we have been involved in changing services and facilities. The next one, please. But this is also how we were working with people. And the next one. We also looking forward to change people's life as much as possible. The first one is a person, the photo of a person living in a social institution, and the second one is the same person once we managed to get her out of that institution in a house where in the community living with everybody else around. And the last picture is an example of something that we produced that is Building Back Better, a publication that tells the stories of emergency setting that moved from the challenges that an emergency context generates to a system, a mental health system developed. So building back better means that we can build better. And we, thanks to the presence of donors and international agencies in those emergency settings, we managed to promote those changes that we try to replicate now. My last To finish with some words from our Director General, Dr. Tedros, the world is accepting the concept of universal health coverage. I think we all know that, and we all agree with that. Now, mental health must be an integral part of universal health coverage. Thank you very much.
Thank you very much, Dr. Castel, because now you have launched us into the next phase of work that we have over here with our second panel, where we're joined by Piroska Öslin, who is the Acting WHO Regional Director for Europe, Erika Placella, the Deputy Head of the Global Programme of Health at the Federal Department of Foreign Affairs at the Swiss Agency for Development and Cooperation of Switzerland, and also Ed Whiting, who is the Director of Strategy at the Wellcome Trust. Ed, let's start off with you then. At the Wellcome Trust, your work is not only to help be the architect of strategy as part of the very top layer of leadership there, but also you are pushing on mental health, you are influencing, you are shaping policymakers internationally. And when we look at the significance of Wellcome, you've got this new fresh investment of £200 million that's going to be directed especially towards its mental health initiative. You just heard Dr. Kirsten talk about that over there. I mean, does it lock in at some point? Is there a natural synergy that you can identify?
Thank you, James, and thank you, Your Majesty, and everyone here. It's a huge honour for the Wellcome Trust to be even in this room, and it's one of the first times we participate in this kind of briefing, so we're delighted to be here. James, I'll answer your question by sort of walking through a little bit what we see and why we are excited about this programme and about the partnership that we have with the World Health Organization. That partnership comes from two key aspects when we talk with Dr. Tedros and his team and everyone else here. It's firstly an alignment on this higher purpose. And across many areas that we work with the WHO on, antimicrobial resistance, epidemics, climate, it's saying, well, what are we trying to do together? And getting out of the weeds of the day-to-day and saying, well, what's the big purpose here? And there is a huge purpose in this mental health programme, so we're excited about that. Secondly, though, it's real clarity about what each of us can only do. What capabilities do we bring to the table? What can we do and what can we do together? And how can we align those capabilities to go further? For us, we are a scientific funder. We fund around £1 billion of research a year around the world. Recently, we realised on our board that we really do need to galvanise the research effort on mental health to face this great generational challenge. Our programme, led by Miranda Woolpert, who is in the front row here, is to rethink science to transform outcomes. So taking the neuroscientists, the clinical psychologists, the global mental health experts, and helping them to work better together so that we can really have an eye on how we can improve those outcomes, create better interventions, and transform the quality of mental health science so that we can change people's lives. And we're really excited about working with the WHO on that. As you say, James, thank you for taking our thunder a bit. It's 200 million over 5 years. That will primarily be spent on science and research. But the question for us is, we are painfully aware that that science and research will be pointless unless it makes it to people. And so it needs to be meaningful at the country level, and it needs to be meaningful at the global level alongside policymakers, national governments, and finding a way for that partnership to work. It's a similar conversation to a conversation we've been having this week about the SDG 3 Global Action Plan, where we've been working on the research accelerator and saying, look, if we don't work in partnership with countries as a research organisation, our research will go nowhere. And that is what informs this partnership too. And that's why, bringing countries and policymakers into the heart of the scientific and humanitarian enterprise is going to be the key to success. We need to act now to scale what works. We need care today and a cure tomorrow. We're focusing unashamedly on that cure tomorrow. How can we transform outcomes through rethinking the science? But we want to work with the WHO on the care today piece. And that in practice means that we are supportive of the WHO approach, the country-led approach, and we want to make sure that we're aligning alongside the WHO. So when we're looking geographically at where we might work globally, or perhaps how we might bring those tools to people, we can work in partnership so that we can bring new interventions that might transform outcomes, but we can reach a legitimacy and a scale with the WHO that hopefully can transform that outcome more quickly for individual people. Final thing to say for us is that we approach this all with humility. Our money, and we talk far too much about money in this building, we should keep on the higher purpose and the change we're all trying to drive. Money is important, but we know that our money is a drop in the ocean, and we're humble about that. We're also, though, conscious that people around the world are desperate to unleash their energy onto this challenge so that they improve their families, their friends, and their own lives. We spend our time going around talking about issues that are hard to put on the agenda, like antimicrobial resistance, and unpacking deeply technical things. This is not one of those areas. Everyone in the world wants to improve everyone else's mental health. This is a challenge that everyone feels right now. No one is untouched by this. We could do the exercise that we've done plenty of times before, where we ask everyone to put their hands up if they are affected by or know someone who's affected by mental health, and you all will, I expect. Everyone is touched by this, but everyone is looking for us to lead. Together in this room, all of us. And this question of partnership and how we form these partnerships is about how we take this and turn this into action. We are starting at a low base, but our opportunity is immense. And so I think for us, this is how we want to work with the WHO, to align and to work together and to try and make all those pieces make the biggest impact possible for the people that whose lives we are desperate to improve.
Well, Ed, in response to your question, I raised my hand to be the first one over there. And I apologize for preempting you on the £200 million. But as you're far too gracious and humble to say that thunder will continue reverberating for many more people and for a very, very long time. So thank you very much to Dr. Ed Whiting for that. We said we are also joined by Erika Placella of Switzerland, and Erika has been working for the last 5 years as the health advisor for Eastern Europe and Central Asia over at the Swiss Agency for Development and Cooperation. But before that, she has this very deep, expanded wealth of experience on the field in Africa, in Asia, and also in the Middle East. Ms. Placella, you've expressed a special interest in this special initiative for mental health. It's obvious to us here in the room, but perhaps for the audience joining us by the live stream, can you tell us what personally moves you to want to move action on this particularly?
Does it work? Yes. So I would like to bring the bilateral donor perspective to the debate, and building also on what the Wellcome Trust representative just said. And well, Switzerland, through the Swiss Agency for Development and Cooperation, supports various programs on mental health, mainly in Eastern Europe and Central Asia, in partner countries where we work on international cooperation. And it includes countries, Deborah, you mentioned, Kosovo, Albania, Bosnia, and Moldova, and very recently Ukraine, including in conflict-affected areas. And I would like to point out just very briefly 5 points, 5 aspects of the global initiative which are particularly aligned with or complementary to our approach, the Swiss approach to mental health in partner countries. As I just said, mainly in Central Asia and Eastern Europe, but also in the Great Lakes area, also very recently. So the first point, first of all, the initiative takes a comprehensive and health system strengthening approach to address mental disorders at all levels, being it capacity building, introducing new forms of therapy, for example, diversification of occupational therapies, or introducing, for example, case management, which is a very good practice we have in Switzerland. So we have used Swiss expertise, for example, we have adapted it to the Bosnia and Herzegovina context. So that's the first point. It's really about taking a health system strengthening approach. And then the second aspect is really about promoting the integration of mental health as fully part of the basic package to be provided at primary health care level and to be covered, of course, by adequate financial protection mechanisms and sustainable financial protection schemes to make it universal health coverage, let's say, ensured. And then the third point, the third aspect of the initiative, which is also fully part of our approach, is really about building, and for a donor is very important, is to build the case for investment in mental health in mental disorders, prevention and management. It's very important for a donor to know how much it costs not to integrate mental health in the primary health care package. How much does it cost, to the countries what are the consequences of not integrating mental health in the kind of health system strengthening support we are providing to these countries. And then the fourth point is really about the deinstitutionalization of mental health services. It's really about being part of this process, which is ongoing, and not only in Eastern Europe and Central Asia. It's really about moving forward with this deinstitutionalization agenda by promoting community-based mental health services, as we saw in the clip, in the movie. And finally, the last point has also been mentioned by at least two panelists, is really about taking an approach which fully integrates solutions to fight against the stigmatization and discrimination against people with mental disorders. And for this, we have the chance to work with Professor Sartorius in Bosnia, for example, and it's maybe one of the most important components of a comprehensive approach to mental health. And final thanks to WHO for organizing a panel on mental health. Mental health is not really sexy for donors. So that's why it's really important to build a case for investment and to share good stories and to bring champions on board and to bring evidence. And that's what we're trying to do, leverage evidence at country level and feed policy dialogue and advocacy work at global level. Thank you.
Well, thank you, Erika Placella, and thank you also to Switzerland for helping to lead the championing of all this. I'm going to turn finally to the Acting Regional Director of the Euro-region, Piroska Özlin, because Piroska, you can help give us the insight in joining the dots of what we've been hearing so far. You are a specialist also in gender equity. When we looked at those videos with Orlando, with Francis Kabila, those are the stories, those are the people that we have to serve as well as each other. Mental health is very, very complex. How does this play into the special initiative?
Your Majesty, Madam Deputy Director General, ladies and gentlemen, dear colleagues, it is really a pleasure for me to be here and be a part of this conversation. And as you could hear from many of you here today, a fundamental element of any individual's health and well-being, including their capacity to live a fulfilling life, is to enjoy good mental health. And as you can read behind me, indeed, there can be no health without mental health. I'm very sorry to inform you that in the WHO European region, the prevalence of mental health disorders now stands at over 110 million people, equivalent to more than 10% of the entire population at any one time. In addition, over 120,000 lives are lost each year in the WHO European region due to self-harm and suicide, including very many young people. So it truly is time to scale up and do something about it. But the question is, what to scale up and how? Mental health conditions are treatable and preventable, and this is a good news. And following a very welcomed request from the Executive Board, so thank you, Member States, WHO is putting together a list of best buys for mental health promotion, protection, and care. To provide accessible care when and where people need it, it is, of course, vital that services should be anchored in the community, which means a scaling down of large, long-stay institutions and scaling up of community mental health teams working in collaboration with primary and secondary healthcare providers. And I think the videos that you could look at was a good example of that. So WHO Europe is working directly with many of its member states to build capacity and support reform along this continuum of care. Firstly, we do it through the application of the WHO Quality Rights Toolkit in more than 20 countries to assess and improve the quality and standards of care from a human rights perspective and ultimately demonstrate that long-term institutions are not the place to provide decent care, meaningful activities, and realizable opportunities for recovery. Secondly, we conduct training of non-specialized providers in the identification and management of priority mental health conditions using the WHO MH Gap Intervention Guide. For example, several capacity building workshops have been undertaken recently in countries in Central Asia, such as in Kyrgyzstan, Kazakhstan, Turkmenistan, and Uzbekistan, which represents a highly significant change in mental health thinking, planning, and service reform in this part of the world. So in this context, I would like to thank the government of Germany for enabling this recent set of successful activities to happen through its financial support to the WHO work. But let me also emphasize the importance of the inclusion of mental health in the SDGs and also the addition of the mental health conditions at the 5th NCD, so to speak, at the 3rd high-level meeting of the United Nations General Assembly, which provides us new opportunities, new platforms to be able, as WHO, support our member states to prevent and treat mental illnesses. So WHO European region would like to express its full support to the Director General's Special Initiative on Mental Health, which seeks to ensure universal health coverage involving quality and affordable mental health care in 12 priority countries across the globe. We believe that the weight and attention that this special initiative brings can take us over the tipping point of indifference towards people with mental health illnesses and conditions, and pave the way for a more enlightened and inclusive approach to mental health promotion and protection at the population level. Thank you.
Thank you very much to Piroska Östlin. This is where we start to include everybody here in the room. I know about 6 people already who want to speak. Anybody else, please raise your hands or your nameplates, and I will get to you one by one. We start with Canada. We have a bit of a limited period of time here. We want to make sure that all voices are included, so we ask you to keep it to about 60 seconds or less. Canada.
Thank you very much. We thank the WHO for your leadership in setting up this very important panel, Your Majesty, distinguished panelists. I would like to make an intervention really to signify the importance of political leadership. I think that no country can really improve the health of its population in isolation. And in our globalized world, organized political coordination and collective political voice can drive progress. So this is why political leadership to address mental health and well-being is extremely important. Last year, Canada was proud to co-found, together with Australia and the United Kingdom, the Alliance of Champions for Mental Health and Well-being, which seeks to address a gap in political coordination on mental health. And so the Alliance offers ministers the opportunity to use their political voice to bring greater attention to mental health and push for change at the highest level within their own countries and globally. So it's an opportunity to learn from each other and share experiences and practices. Currently, there are 18 countries who are members, and so really this is to just encourage ministers to join the alliance. Thank you very much for this consideration.
Thank you very much, Canada. Let's move now to the center of the room, to France.
Majesté, Messieurs, Madame les directeurs généraux, Messieurs, Madame, c'est un très très bref message effectivement pour vous informer que la France est prête à effectivement assurer l'organisation et accueillir le prochain sommet mondial sur la santé mentale. Nous avons un délégué donc en 2020, pardon, c'est le prochain, mais pas de cette année. Nous avons un délégué à la santé mentale qui vient d'être nommé par notre ministre et c'est avec lui effectivement que nous allons travailler étroitement. Je vous en remercie.
Thank you very much to France. We'll move back to this side of the room to the Netherlands.
Thank you very much. Thank you also to Her Majesty, the Queen of Belgium, for your personal involvement. I want to be very brief. As the Netherlands, with the big support of our minister, we created a minimal service package that will be executed by WHO. And in that light, we would like to make the suggestion that maybe in first aid trainings in schools and for volunteers that do first aid trainings, we can involve the elements, the signals of distress for mental health. Thank you.
Thank you very much to the Netherlands. We are going to go to Portugal, followed by Lebanon.
Thank you very much. And Portugal thanks WHO for this briefing and for its flagship initiative focused on scaling up mental health services. However, we must never forget that there is still major stigma attached to mental health conditions, including in the provision of mental health services. Too often, the first layer of stigma and of the associated exclusion comes through the way we look at others. Persons with mental health conditions and psychosocial disabilities continue to be victims of avoidable suffering, discrimination, stigma, violence, abuse, torture, and degrading treatments or punishment in all nations without exception. Portugal calls on WHO not to forget this reality and to scale up its efforts in order to help countries tackle it, namely by ensuring that the good work happening through its Quality Rights Initiative continues and is intensified. We believe it is a game changer in the field of mental health. To conclude, and as it has been recommended in the 2 resolutions of the Human Rights Council initiated by Portugal and adopted by consensus, a human rights-based approach in all actions related to mental health, services, policies, and laws is of paramount importance. It is high time to turn into a reality the change of paradigm in mental health from an exclusively biomedical focus to a more balanced response. Mental health policies should integrate biosocial aspects, conform to human rights obligations, and encompass people-centered, recovery-oriented, and community-based support and services. Thank you.
You can clap if you wish. Please do. Thank you very much to Portugal, then to Lebanon.
Colleagues, I'm very honored and very happy to be here with you today and to listen to this. I'm a psychiatrist. I'm working with the Ministry of Public Health in Lebanon for the last 5 years, reforming the mental health system within the Syrian crisis, where Lebanon is hosting 1.5 million refugees, which is 1 in 4 people in Lebanon. Despite all of this, we've been able to really make real change. And I'm particularly happy today to see this initiative that might not sound as much at first, right? I mean, there's nothing ground shaking. But I think in a few years in the future, we'll look back and we'll look at this moment in history and we'll look at it as a big turning point in innovation in global mental health, because it has 3 big elements that will lead to real impact. 1, it's a system-level approach. 2, it allows time for change. This thing takes a lot of time. And it's aligning national, international resources and using WHO expertise. So from where we stand as a country, and me personally as a mental health professional, I think if we are really ever going to make a change at the global level, we better align behind this initiative, because it's the only way to go. So congratulations to Deborah and the team.
May we return to Peru, to Dr. Sulama Thomas, the Minister of Health, please.
Muchas gracias. Solo para complementar lo que se viene realizando en el Perú, no solamente hablamos de centros de salud mental comunitario. Esto tiene que ir articulado multisectorialmente con instituciones de rehabilitación, con instituciones de emergencia de maltrato, de violencia a la mujer, con instituciones de maltrato infantil y también, por ende, con hogares protegidos. Nosotros los hospitales lo estamos convirtiendo para tratamiento integral de la salud en toda su forma. Ya ha desaparecido en el Perú lo que antes se llamaba los manicomios, ¿no? Gracias a estos centros de salud mental comunitaria. Muchas gracias.
Thank you very much to Peru. We now go to Dick Cloman, who from the International Red Cross and Red Crescent Movement, who today will be speaking on behalf of IFRC, ICRC, and its national societies.
Thank you so much. Her Majesty, Excellencies, and everyone here, I would really like to thank you on behalf of the Red Cross and Red Crescent Movement for your engagement. And thank you also to WHO for providing this platform so we can all meet. We know that mental health is critical to survival. And in our work around the world, we see the extensive unmet mental health needs of people affected by armed conflict, natural disasters, and other emergencies, with far-reaching implications on individuals, communities, and entire societies. Therefore, addressing these needs will be a priority for the 33rd International Conference of the Red Cross and Red Crescent in December this year. We foresee that the 196 states parties to the Geneva Conventions, together with the 191 national Red Cross and Red Crescent societies, the IFRC and the ICRC, will adopt strong and concrete commitments. First, to strengthen the local and community-based response to ensure people's access to mental health and psychosocial support services as early as possible in emergencies. Second, guarantee a continuum of care for people with mental health concerns and to ensure their protection. With our millions of devoted volunteers and hundreds of thousands of dedicated professional staff, the Red Cross and Red Crescent movement is committed to contribute to enhanced efforts to promote mental health. We call upon states and all of you here to join us in this commitment. Thank you.
Thank you, Dick. We'll go to the delegate in the center back of the room, followed by the right of the room.
Perfect, thank you. My name is Billy McCarthy-Price. I'm here as the CEO of Global Voices. We're an Australian not-for-profit, and I guess if I'm allowed to ask the panel a bit of a question or point out potentially a gap. Thank you, first of all, for being here and for coordinating this event. It's a serious gap in the space and in the discussions that we've been having this week. Mental health is a huge absence in the discussion about PHC, and it's really nice to have this avenue to be able to all come together and talk about it. The panel has spoken about the impact of mental health on young people, the serious suicide. This is the second leading cause of death for young people aged 15 to 29. It's a huge issue for us. You've talked about the need to incorporate lived experience into the development of solutions. I just want to know how you're working with youth to co-design solutions that can ensure that, the thing that's killing us the most is addressed, and, to stop us from dying so young and so we can thrive and live a full and wonderful life.
Thank you. We'll go now to the delegate in the grey.
Thank you, Chair. Thank you for the all panel delegates from Thailand. I have 2 points to make. First, I would like to echo the point made by Your Majesty and panel from Bangladesh. Zero stigmatization of mental illness should be set as one of our goals. But to achieve this, we need strong scientific evidence to strengthen our action. Therefore, I would like to request the WHO to provide technical support for countries to strengthen their evidence at national level in order to tackle the stigmatization of mental illness in families, communities, workplace, and healthcare setting. Second, one of the determinants of mental illness is substance use, especially alcohol. Therefore, I would like to propose to include substance use, including alcohol, in one of the package in mental prevention and treatment program provided under USC. Thank you.
Are there any other comments from the floor? From Bangladesh, please.
Thank you for giving us the opportunity. We had a nice panel, Her Majesty and all the panelists. I'm the Health Minister of Bangladesh. So, you know, all the problems that has been discussed here, Bangladesh also faces. Saima Hossain has already elaborated nicely. So we are thinking that how to scale up, that is how to engage the community. And we also need the support, as it has been said, that partnership is important. So we need the partnership of the developed countries and WHO so that to scale up. We don't have enough trained manpower, and how to have the trained manpower in order to serve such a big population, which is 160 million, and in that 20% is having some sort of mental condition. Thank you.
Thank you very much to the Minister. We're now going to go to the Director for Mental Health for Zimbabwe.
And thank you to WHO for organizing and bringing such a spotlight to the mental health issues. I think sometimes it has been really sidelined, and I am grateful that we have this opportunity even today. I want to congratulate Devorah and team for this initiative and showing such strong leadership, which is really what we need in mental health moving forward. Zimbabwe has been very supportive of innovative approaches. As we've seen, the Friendship Bench that originated in Zimbabwe, in the city of Harare, in a very low-income setting in an area called Mbare, where there's a lot of poverty. And we are supportive of cost-effective, sustainable solutions, such as the Friendship Bench. And we would want to continue working with the WHO, and we thank them for the technical support that they've given us. And also, we're very grateful to the Wellcome Trust and the initiative they've shown in terms of supporting research in mental health and development of innovative solutions. Thank you very much.
Thank you very much to Zimbabwe. A quick word also from our Deputy Director General, Dr. Jakob.
Thank you very much, Chairman. Your Majesty, thank you for being here with us today. Your presence shows the importance of this topic. And I would like to thank all participants for the very useful contribution to this discussion. You have seen the figures, which are absolutely shocking, and there is a very strong need to scale up our activities for mental health, and this needs political leadership, this needs a systems approach. And now that we are renewing primary health care, it is an absolutely right moment to integrate mental health into primary health care and integrate primary health care into universal health coverage and put the people in the center. And what we need is community-based services. We need to deinstitutionalize the big institutions. We heard it from many of you. We need to do a lot of capacity building. We need to put resources behind this work, and we also need to build partnerships. And the new action plan that we are launching at this World Health Assembly is a good opportunity to do this. And when we do the operationalizing of the program budget, we have to put this into the focus. We have to select the 12 priority countries, obviously, with clear criteria, but we also need to use the champions that we already have, because there are many, many good examples of community-based services. So count on WHO's full support, and many thanks again to Her Majesty for being our advocate for this important topic. Thank you.
I think something very special has happened today. We have witnessed a tremendous energy for mental health, for people with mental health here in this room, and also joining us again around the world through the live stream here. WHO is the agency to channel this energy to make sure that the maximum number of individuals in the world have their human rights protected and nurtured and will be able to benefit from affordable, effective mental health care. And the new WHO Special Initiative offers promise to deliver on that. Let us all support this initiative. We ask everyone in the room to remain in your seats until our guests leave. We appreciate everyone for joining us. But Your Majesty, you said in your speech earlier about breaking the silence. The silence, unfortunately, remains. But I think what you've done today has to leapfrog some of that and shattered it a little bit more. The World Health Organization thanks you, and I think it's fair to say that the world thanks you also.